Well, the recent Minnesota Timberwolves game was full of punches. First, you had Rudy Gobert punching his teammate Kyle Anderson, and then you had Jaden McDaniels, who punched the wall out of frustration while going back to the locker room and ended up getting a hand fracture. If you're new here, my name's Dr. Adam Nessim. I am a physician interested in sports medicine, and today we're going to be looking at what happens when you punch a wall, what is this injury most likely for Jaden McDaniels, and what we can learn from the situation. So it looks like McDaniels had played about 9 minutes and picked up 2 fouls very quickly in the first quarter and got subbed out. Now, frustrated with those fouls, or that's what the theory is, he punched the wall going back to the locker room, and punching a wall, not a good idea. It never ends well, and sometimes you think you're going to punch through it or it's not going to hurt. Well, that's not true. When you have something static and you come in with a lot of force, that force is all going to be transmitted into the bones of your hand. So what exactly happened? Well, we don't have the full reports right now, but what most likely happened was, if we look at our anatomy tool here, we can see that we have a hand. So these are the 2 bones of your forearm. This is the radius, and then this is the ulna. Now, this is a right hand. So basically your hand consists of the wrist, which is the joint right here. And so you have your radius, your ulna, and then you have 8 carpal bones. Now, the way we learned in med school how to memorize the carpal bones is a silly mnemonic, and the mnemonic goes, some lovers try positions that they can't handle. Okay, so if you use the mnemonic, we'll be able to figure out all the carpal bones. So if we start on the lateral side, you first have the scaphoid bone, then you have the lunate, then the triquetrum, and on the back side of the triquetrum, you're going to have the pisiform. Then coming back over to the lateral side, and more distally, you're going to have the trapezium, the trapezoid, capitate, and then the hamate. And on the hamate, you have something called the hook of the hamate. Now, all of these bones can get fractured, but what generally gets fractured when you punch a wall is actually your metacarpals. So these bones right here. So first you have your carpals, then your metacarpals right here, and then you have your phalanges. So you usually have a proximal, middle, and distal phalange, as you can see here. Now, when you punch, you're generally supposed to be punching with your 2nd and 3rd knuckles, but what happens a lot of times, especially if you're inexperienced, or this can just happen in fighting, especially if you're coming and throwing some sort of hook or not on a straight angle, you're gonna usually injure the 5th metacarpal. So right here, this is usually what is injured when you punch a wall. And if I were to guess, just pure going on statistics on what's most likely to be injured, I bet McDaniels has some sort of hairline fracture, at the least, to the 5th metacarpal right here, and we call this a boxer's fracture. Obviously, based on the name, it's because it happens a lot with boxers, or honestly with inexperienced fighters or people that punch and don't know how to punch. So that is most likely where the fracture is. Of course, any of these metacarpals could be injured. You could also injure some of the carpal bones, but this is again going to be the most likely injury. So what we usually do, if it's not too bad, you can actually just cast or splint the hand and rest it. If there is some sort of dislocation or it's a very bad fracture, then it usually requires surgery, where you're going to put a pin in to give more structure to the fracture to let it heal better and more structural integrity. So just wanted to give a quick little rundown of what might have happened in this case, and a PSA out there: if you're frustrated, please do not punch a wall. And to prove to me that you're not going to punch a wall, what you can do is subscribe to the channel right now as a pledge that you will not be giving yourself a boxer's fracture anytime soon. I really appreciate, hope you are enjoying these sports medicine recaps, and I will see you in the next video.